Let's dive right into this. Welcome to today's explainer, where we're going to pop the hood on human metabolism. We usually think about weight just in terms of calories in, calories out, right? Like it's just a passive storage unit. But what if I told you the way our bodies handle excess weight is actually way more complex and honestly a lot more active than that? Today, we are mapping out the absolutely crucial link between obesity, insulin resistance, and the actual health of your vital organs.
So consider this for a second. What if the real danger of obesity isn't the physical weight itself, but a totally silent alarm going off inside your body? We're challenging the old school views of weight gain today. It isn't just about the physical space that fat takes up, it's really about a quiet, invisible chemical alarm system that gets tripped, and it starts damaging your organs long before you ever see a single symptom. Here's our roadmap for today. First, we'll look beyond fat storage. Second, we'll cross the inflammatory bridge. Third, we'll uncover silent organ damage. And fourth, we'll talk about reversing metabolic dysfunction.
All right, section 1, beyond fat storage.
So what exactly is adipose tissue doing inside us? Is it just sitting there collecting dust? Well, we used to view obesity through this old, outdated paradigm, right? Thinking of it as just a calorie imbalance, where fat is just a passive storage locker. But modern research paints a totally different picture. Fat, and particularly that visceral fat that packs around your abdominal organs, is actually an active endocrine organ. It's basically a rogue factory pumping out active inflammatory mediators that mess with your entire body. It is not just storing calories, it's actively talking to your internal systems.
And you know, that communication, it comes in the form of metabolic inflammation. Now, this isn't like the acute inflammation you get when you, say, sprain your ankle. That kind is fast, painful, and it's there to protect you. This is a slow, quiet, chronic, low-grade inflammation. Basically, immune cells actually infiltrate this expanding adipose tissue, and this persistent inflammatory environment just completely derails your normal metabolic pathways. It's systemic, and honestly, the scariest part is that it is completely silent.
Moving right along to section 2, the inflammatory bridge. Okay, so how exactly does this rogue factory disrupt the body's natural insulin signaling? It's literally a biological domino effect. First, excess visceral fat builds up. Because of that buildup, immune cells kind of freak out and launch an attack, infiltrating the tissue. The real trouble starts when this tissue starts pumping out inflammatory cytokines. We're talking about substances with complex names like tumor necrosis factor alpha, interleukin-6, and C-reactive protein. These mediators physically interfere with your insulin receptor pathways. Normally, insulin is like a key, right? It perfectly unlocks your cells to let glucose in for energy. But these cytokines, they basically jam the lock, completely blocking the uptake of glucose.
So what happens when the locks are jammed? Well, we enter what I like to call the pancreas overdrive. Because your cells are now less responsive to insulin signals, which is what we call insulin resistance, the pancreas is forced to work massive overtime. It literally has to pump out higher and higher amounts of insulin just to keep your blood glucose levels normal. Now, initially, your body can handle this. It compensates. But eventually, those poor pancreatic beta cells just struggle to keep up. And when they finally fail, blood glucose shoots up, which significantly increases the risk of type 2 diabetes.
Now, chronic inflammation, excess free fatty acids, oxidative stress, these are all driving this resistance on a biological level. But here's the kicker. Everyday lifestyle choices, like a sedentary routine or poor dietary patterns, they act like pouring gas on a fire. They completely accelerate this dangerous cycle. It's really this complex, tangled mix of our biological responses and our everyday decisions that ultimately tips the scales.
Which brings us to section 3, silent organ damage. Let's take a quick tour of the body under the stress of this systemic metabolic dysfunction. Starting with the liver, excess fat leads to MASLD, or metabolic dysfunction-associated steatotic liver disease. And that can progress to fibrosis, cirrhosis, or even full-blown liver failure. In the cardiovascular system, insulin resistance causes hypertension and accelerates atherosclerosis, which drastically bumps up your risk for a heart attack or a stroke. Over in the kidneys, chronic inflammation puts immense stress on renal blood vessels, paving the way for chronic kidney disease. This dysfunction is literally destroying tissue and wreaking havoc across major organ systems for years before anyone ever hands you a formal diagnosis.
But perhaps the most shocking hidden casualty here is actually the brain. We usually separate body weight from cognitive health, don't we? But emerging evidence is showing us that metabolic inflammation actively influences cognitive decline, depression, and even neurodegenerative diseases. In fact, researchers are heavily looking into the relationship between insulin resistance and Alzheimer's disease right now. I mean, that really shakes off any complacency we might have about metabolic health, doesn't it? It's not just your body, it's affecting your mind too. Okay, let's pivot to section 4, reversing metabolic dysfunction. The absolute best news here is that this whole chain reaction can actually be stopped, and in a lot of cases, it can be totally reversed. The secret is catching it early. You've got to watch for early warning signs. Things like central obesity, elevated fasting glucose, high triglycerides, low HDL, that's your good cholesterol, hypertension, and even highly relatable everyday things, like that profound heavy fatigue you feel right after meals. That food coma, it actually ties directly back to the science we just unpacked about your body struggling to process glucose. So, the name of the game is early intervention. One of the absolute biggest hurdles with metabolic disease is that the early stages are practically invisible. They're totally asymptomatic. People walk around completely unaware they have insulin resistance until severe complications hit them out of nowhere. Because of that, proactive intervention is crucial. Healthcare professionals are heavily advocating for preventative metabolic screening to identify these issues way before the dominoes start to fall, rather than just waiting around to react when overt disease sets in. So, how do we actually intervene? Well, lifestyle modifications are, for sure, the absolute cornerstone of managing this. Yes, it's about regular physical activity and weight reduction, but it's also about a balanced nutrition plan, packing in the fiber, lean proteins, fruits, veggies, and healthy fats to actively dial down that inflammatory burden. Pair all of that with better sleep quality, stress management, and definitely quitting smoking if you do. These everyday, actionable habits, they are your frontline defense to improve your insulin sensitivity and basically shut down that rogue endocrine factory for good. Now, comprehensive healthcare is the ultimate goal here. And while lifestyle changes are incredibly powerful, we have to acknowledge that sometimes, honestly, they just aren't enough on their own. Pharmacological therapy might be required to manage those glucose levels, treat obesity, or mitigate some of those severe cardiovascular risks we talked about earlier. Modern medicine tackles this from all sides, combining those foundational lifestyle habits with targeted medical intervention when you need it to protect your organs. We've seen today how obesity is so much more than just a number on a scale. It is a deeply complex metabolic and inflammatory disorder with profound systemic consequences. But understanding this biology, that is your first step toward true health. So, I'm going to leave you with one final thought. Are you just waiting around for symptoms to show up, or are you actively protecting your metabolic health today? It's time we start viewing our metabolic health proactively instead of reactively. Thanks so much for joining me for this explainer. I really hope this empowers you to take charge of your health right from the inside out.